In this video, we will be discussing about prediabetes, the only prediabetes guide you will ever need to know. But first things first, let us find out what prediabetes is. But before we go into the main discussion in this video, don't forget to subscribe to our channel and hit the bell icon to get notified for more awesome videos like this if this is your first time on this channel. Thank you. What is prediabetes? Prediabetes is a type of diabetes where blood sugar levels are higher than normal, but not high enough to be diagnosed as diabetes. As many as 20% of people may experience prediabetes, but only 0.7% will develop diabetes. Prediabetes is diagnosed when a person has fasting blood glucose above 100 mg per deciliter (mg/dl) and hemoglobin A1c, HbA1c level above 5.7%, a 2-point increase from the baseline value at 1. What is the difference between prediabetes and diabetes? Prediabetes refers to a state where blood glucose levels are high. It is sometimes referred to as impaired fasting glucose. In this state, blood glucose levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes. Prediabetes is important to be aware of because it is a risk factor for type 2 diabetes. If your blood glucose levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes, you should contact your doctor to see what can be done to lower your risk of developing type 2 diabetes. There are many ways to prevent type 2 diabetes. You can exercise regularly, eat a healthy diet, and avoid taking in too many calories. 2. What are the symptoms of prediabetes? The symptoms of prediabetes are similar to those of type 2 diabetes, but prediabetes is not yet diagnosed. This means that you may not know if you have it. The symptoms are frequent urination, frequent thirst, frequent hunger, frequent fatigue, frequent weight loss, frequent dizziness, frequent blurred vision, frequent blurry or double vision, frequent swelling in hands, feet, or face, frequent pain in the lower back, hips, or joints, frequent infections, frequent vaginal bleeding, frequent wound healing problem. 3. How do I know if I have prediabetes? Though it can be hard to tell if you have prediabetes, you can look for subtle signs. If you have one of these symptoms, it does not mean you have prediabetes. However, you may want to bring it up with your primary care provider at your next appointment. Blurry vision, cold hands and feet, dry mouth, excessive thirst, frequent urination, increase in urinary tract infections, increased irritability, nervousness or anxiety, itchy skin, odd sensations such as tingling, numbness, pain or burning in your extremities, recurring infections, thick, dark, velvety patches on your skin, especially near armpits, neck and elbows, unexplained weight loss, unusual fatigue, wounds that won't heal fast. A blood test can tell you if you have prediabetes. There are several different types and they are the same tests that diagnose type 2 diabetes. Talk with your primary care provider to see if they think you need one of these tests. 4. How is prediabetes diagnosed? There are a few ways to diagnose prediabetes. One is through a fasting glucose test where the person is given a glucose drink and the blood sugar is then measured. Another way is through the hemoglobin A1c test. The hemoglobin A1c test measures the average blood sugar over the last 3 months. The most common way to diagnose prediabetes is through a clinical exam. The doctor will ask a series of questions about your lifestyle and health history. After answering these questions, the doctor will conduct a physical examination to test for any abnormalities. If the doctor finds anything abnormal, they will conduct additional tests to rule out other illnesses or conditions. 5. Reversing prediabetes. If you are diagnosed with prediabetes, that's a signal to take action to protect your health. Most people diagnosed with prediabetes develop type 2 diabetes within 10 years. This means you should have time to prevent this from happening. On the other hand, it takes about 3 years to reverse prediabetes. You also have to change your lifestyle. To reverse a diagnosis of prediabetes, take the following steps: eat a clean and healthy diet, drink more water, shed 5% to 7% of your body weight, stop smoking, walk or exercise for 30 minutes a day 5 days a week. Thank you for watching this video and don't forget to subscribe for more awesome videos like this.